There is already a lot of risk assessment tools out there, and a similar amount of treatment, modalities, manuals, skills training programs, etc. But what we aspire to do in the National Unit of Mandatory Care is to bridging the gap between risk assessment and treatment. We now use the Armadillo, that is a risk assessment tools specifically designed for people with intellectual disabilities and autism spectrum disorders, which consists of both risk assessment of the person but also of the milieu. For instance, how the staff conduct themselves together with the patients. So everyone knows from clinical practice that the attitudes the staff has towards the group they're working with will also, or could be, or can be, a risk factor. And for instance, if they have a little time of overlapping between staff, that can also lead to more violence the next hours in the milieu. So the Armadillo, more than the other risk assessments, will take account for also contextual factors. But what also is lacking, in our view, is how to work with the patients and the staff when you have found the risk factors. So for that purpose, we have developed something we call KAOS, which is translated to cognitive behavioral therapy for people with special needs. And the idea between KAOS is that for each risk item, there will be a corresponding theme or module for how to reduce that risk. So for instance, if the patients have or lack social skills, we can then of course train the patients in social skills. And of course we could use a lot of the already existing manuals of treatment program in regard to this, but we have developed our own where the staff is also in the group. So when we learn the patients the skills needed, it is the staff that normally work with the patients there that are in the group and also lead the group. So when the treatment session is finished, they both go back to the milieu, and in this way it's easier to generalize the skills they've learned in the sessions. But we have also learned that some of the staff needs training. So what we also do, we will assess the staff. And for this we use another tool we call the dialogical communication, which enable us to monitor and score staff skills in communication and decision making. And after we have done this, we will then sit down together with the staff and found through the assessment and profile that we will make out of it which kind or which part of the communication that needs to be worked with. So to reduce risk, we both assess and treat patients and staff. So we have the Armadillo, that is the risk assessments tool. We have KAOS, that is the treatment module. And we have the dialogical communication, which is how to train the staff. And this will make 3 points that we will constantly work with both the milieu and the staff and train them both. to reach our aim of bridging the gap between risk assessment and treatment. We have developed our own web page for this. It's called TotalKAOS.no. This will give us the opportunity to train also people without prior knowledge or outside of our own institution. And last year we had like 40 training sessions with people outside of our own institutions around Norway. We will develop this program for the next year or so, and hopefully this will be beneficial for both patients and their staff. Thank you.